What do Americans celebrate every year on the 11th day of November? You guessed it right, Veterans Day. Veterans Day is a U.S. legal holiday dedicated to American veterans of all wars. So when did it start? In 1918, on the 11th hour of the 11th day of the 11th month, an armistice or temporary cessation of hostilities was declared between the Allied nations and Germany in World War I, then known as the Great War. Commemorated in many countries as Armistice Day the following year, November 11th became a federal holiday in the United States in 1938. In the aftermath of World War II and the Korean War, Armistice Day, also known as Remembrance Day in other countries, became known as Veterans Day in the United States. Currently, there are about 20 million veterans living in America. We thank them for their contribution to the protection and defense of our country. But are we doing enough to honor them? Are we giving them adequate care and support every single day and not just on Veterans Day? Care for veterans is a multifaceted pursuit, and this presentation will primarily focus on the healthcare support that veterans receive from the government. We all know that veterans are eligible for healthcare services through the Veterans Administration or the VA. The VA operates the nation's largest integrated healthcare system with more than 17,000 hospitals, clinics, community living centers, counseling centers, and other facilities. However, of the approximately 22 million veterans in the United States, only 30% are enrolled in the VA. And despite thousands of available resources for the veterans, why is the VA still not able to meet the current healthcare needs of our veterans? Again, to be as specific as possible, our group decided to focus on VA modernization and transformation, which includes strengthening the nursing workforce and increasing nursing leadership within the VA system. To help us understand the nitty and gritty of our chosen topic, our group interviewed the Director of Advocacy and Government Relations of the Nurses Organization of Veterans Affairs, or NOVA, Ms. Teresa Morris. NOVA's mission is to educate, communicate, and advocate for the Veterans Administration nurse professionally, personally, and legislatively. Its vision includes, among others, that VA nurses will be informed on relevant issues that impact VA healthcare and nursing practice, that VA nurses will have a strong voice in the legislative arena, and VA nurses will have a strong presence at the VHA corporate leadership level. When we asked Ms. Morris about the current policy challenge that NOVA is facing, she said it's the lack of nursing representation in VA leadership. In fact, NOVA incorporated this as one of their legislative priorities under the VA Modernization and Transformation goals. Looking at the current leadership structure of the Department of Veterans Affairs, none of the top leadership belongs to the nursing profession. In fact, the Office of Nursing Services is just under the Veterans Health Administration, which is, well, not even shown on the organizational chart. Why is it important to involve nurses in top leadership at the VA? It is safe to say that with the current educational advancement and experience opportunities provided to RNs, along with the existence of advanced practice RNs, which, by the way, have been around for decades, there is a great chance that the VA healthcare system will improve dramatically. Nursing has several specialty areas that focus on numerous health issues that our veterans are facing, such as infectious diseases, trauma, disabilities, and mental health issues, among others. Nurses are trained in therapeutic communication techniques and can be very effective when dealing with more than 700,000 veterans suffering from post-traumatic stress disorder or PTSD. Studies have shown that veterans who receive care through the VA contribute to decrease in suicide rate among veterans. But why is this such a difficult and challenging issue? Just like other government organizations, it is not without controversies. Reports of mismanagement have surfaced in the past that brought to light multiple issues within the VA health system. In April 2014, multiple whistleblowers in the Phoenix VA healthcare system stepped forward with allegations of two separate waiting lists: the public electronic list and an offline secret list maintained to enable falsifying the electronic results to keep patient wait times within VA's acceptable guidelines. In the aftermath of the allegations, on May 2, 2014, two VA employees were motivated to move to secure documents alleging that there was a systematic effort underway at the hospital to shred documents to eliminate evidence of the waitlist cover-up. When that story caught the attention of the media, it exposed many other issues and scandals involving several VA health systems across the United States. It gave birth to the hashtag #NotJustPhoenix. On April 7, 2016, USA Today report detailed that VA employees in 19 states and Puerto Rico regularly zeroed out wait times, hiding the true length of delays, and VA supervisors themselves ordered the fabrication of wait times at medical facilities in 7 states. A survey conducted by the Kaiser Family Foundation on June 12 to 18, 2014, revealed that majority of those in military households thought that veterans receive worse care from VA as compared to private providers. So what initiatives has NOVA supported to address the current healthcare issues our veterans are facing? There's the Patient-Centered Community Care Program, or PC3, which is a nationwide program of the VA that utilizes healthcare contracts to provide eligible veterans access to primary care, inpatient and outpatient specialty care, mental health care, limited emergency care, and limited newborn care for enrolled female veterans following the birth of a child. Other strategies that NOVA helped implement include working with the VA on resource allocation. As of December 14, 2016, VA APRNs, or Advanced Practice RNs, were given full practice authority regardless of state restrictions. And as of April 2017, the VA had 97,521 nursing personnel and still growing. On June 5, 2017, then VA Secretary Dr. David Shulkin announced his decision on the VA's electronic health record system. For 2018, one of the NOVA's legislative priority goals, as mentioned earlier, is the VA Modernization and Transformation. NOVA will continue to support VA's modernization plan, which must include appropriate use of funding and inclusion of nursing in strategic decision-making, access, operational efficiency, research, and academic efforts. NOVA will also continue to push for restructuring of the VA organization by allowing nursing leadership to make decisions related to their nursing profession. While it may seem like NOVA has a long way to go, we can be certain that they are taking several important steps to increase nursing leadership within the VA system. Once this goal is achieved, nurses will have plenty of opportunities to help create change in the VA, with the hope that our veterans will receive excellent health care as a result. Thank you for listening to our presentation, and I hope that you learned a lot from what we just presented. Thank you.